Thank you so much for the opportunity to share with us the reasons and the usefulness to why we need to use data in supply chain management. First of all, my name is Anthony Kirunda from Uganda, working with Management Sciences for Health on the USAID Uganda Strengthening Supply Chain Systems um, activity. So we need to just have a few lessons from Uganda here on how we can use data to improve supply chain management. First of all, just talking to the definition of why and what is supply chain management. These are just talking to the processes and the points through which we deliver the activity. I mean, the products right from the manufacturer up the end user. So all those right from determining what the product we need and what do we need to deliver that product through up to the user. Those we need to make sure we handle all those data points. And so as we go through that, we need to look into how visible the data is, and also that we can understand the whole supply chain process in order to ensure that we have confidence in analyzing and decision making for supply chain. So just talking to a few activities that happen throughout the supply chain process, beginning from the diagnosis, a bit of it, we get data from there. What disease is, what disease partner is in this community, and then how do we treat it through dispensing. At the dispensing point, we are looking into things like what commodity was prescribed and how much was prescribed and what was issued and what was missed out. So we collect all that data, which inform the selection of the products that we need to ensure it's available at the health facilities. Those products are selected, and then we quantify, basically adding on numbers to see that we can talk to how much of a particular product is needed. So we then forecast and look into the future that for 1 year or 2 years or 3 years, this is how much would be needed. And then we can continue to start pulling from that quantification that's making the routine orders, which can be monthly, bi-monthly, or quarterly, to the warehouses. And then the warehouses, they prepare and pack these products and they distribute to the facilities which warehouse them or store them, and then they can issue to the treatment centers, and the whole process continues. So through all that, we need to ensure there is a visualization of all those processes as they go on. So, but why is it important that we can see data or can use data in supply chain management? There are very many issues and reasons that we can put together, but I've tried to summarize this into 4 key areas. One is that optimal utilization of the already scarce resources for health is very key. Just if we can remember the Abuja Declaration that at least for every country, we need to ensure we have at least 15% of the national budgets put aside for health. But most of the countries in Africa and most of the developing countries are not even hitting 10%. Most are running between 6 to 9%. So we need to ensure that we optimally utilize those resources which are already scarce. Then also we avoid wastage, because if we do not use data for decision making, we are going to have overstocks, expiries happening because we have procured commodities which we do not need, we over quantified. So there will be a lot of wastages there which we need to minimize. But however, also data is important because it improves transparency and objectivity in decision making, because once someone sees that you are using data, that you are saying that we needed 20 units of a particular commodity, and that's exactly what we are using based on the data that we have. It's very important, and so teams will start to see that there's transparency in this whole activity. But also it will put up an incentive for the people that collect data. Because, you know, when they keep collecting data and we do not send it back to them using that data, we are like, from your consumption, this is how much you need. They do not see the essence of why we would need to collect this data. So it is important that we use this data. Then it because of that, will be an incentive to data collection and also fostering accuracy of this data that's being collected right from the points of source. Now, looking through the various sources that we have of supply chain data, there are a number of challenges that come with it. Like for example, using Uganda as a case, we get data for supply chain from various areas, beginning from program data, program targets, and demographic data, a number of points we use. But just trying to a little bit go through this slide a little bit, which is a bit busy here. Program data. This can be program progress reports, and then we have evaluation reports and all that, and policy strategic documents. We have a number of challenges that come with it because sometimes it's out of date, and also it may not reflect the current issues at the ground. The other is about the targets, the national the targets for the programs. Sometimes the targets can be politically motivated. For example, distribution of nets and all that, it can be tagged to, maybe it's a political season, like their campaigns and all this, and it can be a problem because they just want to use the program target, like distribution of nets, but during an election period, which can be a very big problem, and it may not be very accurate. But we can also use demographic data, though they also come with challenges. Like, for example, the demographic health surveys, they take between 4 to even 6 years to be implemented. So they can be out of date, they may not be current, but also like the national censuses, they are not carried out so routine, and so they may not be up to date. Sometimes we also use the demographic mobility data, which talks to epidemiological surveillance and incidence reports. These also can be a problem because they can be outdated, but also they may not be exactly accurate because they just use a few areas which they use the data to make an inference and for the whole population. But also we can use the services data, like at clinics, we can use the HMIS reports and program monitoring and evaluation reports and health facility surveys. The challenge we have with this is that they can also still be outdated, but also the data may not be available or may be incomplete. For example, HMIs, tools like the OPD registers, sometimes they are not well filled because of very many reasons, but some of which may be because they are not well supervised, but also the facilities not see exactly so much essence of why they need to complete those tools. Consumption data would be the other very good area to look into. And challenge we have with it is that it's largely in a raw data. For example, stock cards and stock books, they are not analyzed, so it's in raw form, and also sometimes not properly updated. So because of this, we have seen a number of challenges which come up. For example, right now, a case in Uganda, reporting of the monthly reports, that's HMS 105, only just around 40% of the health facilities are completing the supply chain components. Okay, and even the 40%, only around 10% is complete, which is very big challenge because only 10% of the data can be used. And then also we have seen maldistributions of stocks going throughout the whole country. Like, for example, if you can look at the ARVs, just looking at the graph currently here, just using the same and similar commodities, ARVs, you see 13% of the health facilities are stocked out, data which is for July, and yet 30% of facilities are overstocked with same commodities. And so you just keep asking yourself a question that if we could reduce the overstocks and then we can do away with the stockouts, we would have covered a great deal. So, and cuts across the various baskets of our commodities. The other is about no routine data being collected, which is a big problem. The data is not available for planning and decision making. So visibility into and traceability into the data at those data points is a problem. We have seen some expiries and wastages, again, due to those maldistributions. Governance is a challenge because we do not see the leadership coming in up the health facility telling us that we need this data, and with the enforced implementation and collection of this data is a problem. But also the other issues are things talking to the fragmentation of supply chain systems that are an individual will come and say, me, I'm looking at HIV, another one looking at reproductive health, another one looking at malaria, TB, and all that, which are leading into wastages. But also we have shortfalls of human resources. In Uganda, we have improved in trainings, or particularly for the pharmacists. They are now coming out quite in big numbers because we have various institutions training. The challenge we have is that also these have not been placed into the health facilities. They are coming out, but the structures are not taking them up because they are currently supposed to be only in hospitals and starting from general hospitals up to national referral, which is a big challenge. And even there are only a few positions available. We need to see that we can improve this. But also we have limited budgets. Like I said, that for Abuja Declaration, only most countries are running between 6 to 9%, but also for supply chain, up to over 70% of the national supply chain budgets are financed by donors. Yet we are supposed to be moving towards a journey to self-reliance, and we can only do that if we can flip this around. And also, like I said earlier, we have seen a lot of wastages happening. We have seen expiries happening. Currently, there is from data of 2020 to 21, just July, 2 months ago, we have over $2.9 million in expiries. That's a lot, and it's cutting across all commodities. The number of reasons to which are causing these expiries, but we just need to see that we can mitigate them, particularly through the use of data. Now, the question you would ask yourself is what can be done differently? We think that two major issues here. One is that we need to make sure we develop policies and also implement them, which are supporting data use in supply chain decision making. But the other is digitization of supply chain processes so that we can improve on the visibility of data right from the sources. And so we have envisaged a data map here, which is talking into having a central data warehouse, which we call the Pharmaceutical Information Portal for the coast of Uganda, and is sitting at the Ministry of Health and is being backed up at NITAU, that is the national agency for information. So that's where we're backing it up, but the data warehouse is sitting at the Ministry of Health. So we want, and we are starting to work on this to see that all the electronic medical records are talking to the Pharmaceutical Information Portal. We are pulling in all those demographic data, demographic data, and the morbidity data is coming through from the EMRs, and then we have the electronic logistics management information systems, which are purely working on the supply chain data. They should be from the health facilities coming in to the Pharmaceutical Information Portal, which is at the center. Then we have the national warehouses. For Uganda's case, we have two major ones, national medical stores and then the joint medical store. Their data talking to the stock availability at the center, and also the orders, how they're coming in from the health facilities, going through the national warehouses, but then we pull that data into the Pharmaceutical Information Portal. We have the regulatory arm, and that's the National Drug Authority. That's good distribution practices and good pharmaceutical practices data, and also the registration data for commodities which are in national register coming into the to the Pharmaceutical Information Portal, and all that data is aggregated and presented into through dashboards and reports, which can be visualized at the center. But for all this to happen, we need to ensure that there's very good leadership, there's very good governance, there's efficient use of the already scarce resources, like we said, and which we can use this again to ensure we do resource mobilization. Thank you so much for listening. I'll be available for any questions and clarifications. Thank you.